Welcome to the Non-Medical Bloodborne Pathogen Exposure Control webinar. Your chance of being exposed to bloodborne pathogen at work is low. Blood is the most important source of these pathogens in the workplace, and it's not likely you have much contact with blood in your day-to-day job. However, it is important for you to be aware of what bloodborne pathogens are, the diseases they cause, and how to protect yourself from being exposed. Today's objectives. You'll know firsthand what you can do to protect yourself and others. You'll have a better understanding of methods of compliance. You will know what to do if you are exposed to a pathogen. Over 5.6 million workers are at risk for exposure to bloodborne pathogens. Approximately 300,000 people are infected annually with bloodborne pathogens. Over 1 million people may be carriers of the disease. Each year, more than 5,000 people die from chronic liver disease and liver cancer linked to hepatitis B. Hepatitis C, according to the Center of Disease Control, 85% of people infected with hepatitis C have chronic infections, while only 10% of those with hepatitis B are chronically infected. Why do we need this training? Anyone can be exposed to someone else's blood during work hours, through accidents on site, during work duties, accidents in the field. Although infrequent, risky situations do happen at work. Bloody noses, bites, serious falls, lacerations, all have potential for blood exposure. California Code of Regulations, Title 8, Section 5193. The requirements are, employers should have a written plan, that'd be the Bloodborne Pathogen Exposure Control Plan, determination of the exposure of those employees who are at high risk, control of exposure, what measures the employer and the employees must take to protect themselves, training, vaccination with follow-up, and record keeping. The definition of bloodborne pathogens. Bloodborne pathogens are a disease-causing organism found in the blood of an infected person. Examples include hepatitis B virus, the hepatitis C virus, and HIV, human immunodeficiency virus. What is hepatitis? Hepatitis B and C are both viral infections that affect the liver. What it can do to the liver. Acute hepatitis of a newly infected person, short-term. Chronic lifelong hepatitis, long-lasting infection. To the right is a photo of a liver-related cancer generated from untreated hepatitis C. Hepatitis B and C virus. Major infectious bloodborne hazard. Symptoms include loss of appetite, nausea, abdominal pain, fever, headache, jaundice, weakness, and fatigue. The key is to know you have had an exposure and also start having the symptoms, and the symptoms don't improve in a short period of time, usually 3 to 4 days. Then you should seek medical advice. Hepatitis C and B transmission. Sexual activity, being born to an infected mother, use of infected instruments, tattooing, ear piercing, and yes, sharing toothbrushes, needle injecting, direct contact with infected blood with mucous membranes or broken skin, touching an infected object and transferring to the mouth, eyes, nose, or any open skin. In our society, bloodborne viruses are most commonly transmitted through sharing of needles or having unprotected sexual intercourse with an infected person. They are also spread through contact with other potentially infectious materials, or also known as OPIM, including semen, vaginal secretions, as well as any other body fluid or tissue containing visible blood, feces, urine, vomit, nasal secretions, sputum, saliva. You must be careful and protect yourself. Assume all body fluids are infectious. HIV virus, it attacks the immune system, eventually results in AIDS. Symptoms include fever, diarrhea, fatigue, flu-like symptoms. HIV methods of transmission: through unprotected sex, being born to an infected mother, using infected instruments, needles, possibly through infected blood, and possibly through breastfeeding. Exposure incident: infectious materials contact that results from the performance of one's duties. Cleanups, for example, when cleaning up potentially contaminated sharp objects such as broken glass, you should always use a broom or a dustpan. Never use your hands. Whenever possible, use disposable materials such as paper towels and dispose of all materials according to your employer's policy. Most exposures do not result in infection. This is the good news for both employees and employers. Variable factors include the pathogen involved, the amount of the virus in the source patient's blood at the time of the exposure, the type of exposure, the amount of blood involved in the exposure incident, the immune status of the exposed person. Exposure concerns: if you're unable to identify someone as being hepatitis B, hepatitis C, or HIV positive just by looking at them, symptoms appear long after the exposure. Hepatitis B and hepatitis C, 45 to 160 days after exposure at minimum, and HIV is 10 or more years. It's also important to point out that the hepatitis B virus has been known to live on countertops and bathroom floors for up to 7 days. All exposures and every potential exposure must be reported. Preventing exposures: use universal precautions. No eating or drinking in areas that may be contaminated. Remove protective equipment before leaving your work area. Never reach into a container that might contain needles or broken glass. Treat all body fluid as if they are infected. Wash your hands thoroughly. Use gloves. Use disinfectants. Use CPR barriers. Properly dispose of biohazardous waste. And when you do use gloves and you take the gloves off, wash your hands immediately. Hepatitis B immunization. It is typically offered at the time of assignment to high-risk employees. It's offered after an exposure, and it's at no cost to employees that are at high risk. All employees are covered that are at high risk. The immunization process is very simple. It's basically 3 injections. The second one is 1 month after the first, and the third injection is 6 months after the first. The immunization and vaccination is available typically through your public health department. It's better than 90% effective and minimal side effects. Post-exposure procedures: wash the affected area immediately with soap and running water. Identify the source of the exposure. Notify your supervisor immediately. Complete the appropriate incident report before the end of the work shift. You need to know exactly what your employer's procedure is when an exposure occurs. Talk to your supervisor if anything occurs. Post-exposure follow-up. There's a medical evaluation after exposure. The vaccination is recommended. Vaccination is typically received. Results and records are confidential of any exposure. Results and records of the source individual are also confidential. Thank you for your participation. There's going to be a short quiz, so you should have all the answers available to you, and if you need further information, please contact me. Please remember to use all the tools available that will keep you safe. That includes personal protective equipment, gloves, goggles, masks, etc. Approved cleaning and disinfecting procedures, and use universal precautions. Our next webinar will be Effective Safety Committees. Thank you very much.